the transformative role of AI in women's health. And as you can see, the market is going on. It's getting commercial. It's getting successful. It's getting accepted by authorities across the planet. And the market is frankly growing at a rate of 48%. But sadly, only 20% of the healthcare facilities are correctly using it, though the potential is huge. So, when are the reasons? First of all, like necessity is the mother of invention. So, why should you do it and why AI should jump in when we have been having a lot of regular healthcare facilities giving good results? So, if you look at the research part, research are huge and research protocols are so based that it is sort of difficult to conduct research in a classic manner. With AI, the researches are much faster, like AlphaFold for protein molecule analysis, a drug which takes 10 to 12 years to come out in the market. You undergo animal studies and human studies. All that can be done through AI in less than 6 months to 9 months. And as you can be aware, a plethora of new molecules are jumping up, and you don't need live human and animal studies to do that. So this is all silico analysis. One very important part is that all these research protocols are primarily have been done in the majority on male physiology. So there is no data which is available so much on female physiology. Then there is a significant gap in the diagnosis and treatment. There is a lot of problem that we have discussed in the past sessions also, that a lot of data is coming from the Western world and it is not applicable in the Asian population, in the South Asian population, or the poorly privileged or low socioeconomic countries. Then there is a lot of barriers and access inequities are existing in quality care. So different women are treated differently in different healthcare systems, and those bridges are possible to do with an artificial intelligence subway. So what is AI? So AI has got multiple things here: machine learning and artificial intelligence are something which are not exactly synonymous. They literally go hand in hand. But the advantage is you can do a lot of predictive analysis. So the kind of pickup that you get with AI is much faster, and you can sort of do a futuristic analysis. So those of you who have seen the Mission Impossible, I just saw the latest Mission Impossible 3 days back, where Tom Cruise is discussing about that entity called Entity, which is controlling the whole planet, and it is a destructive entity. And they have shown how clearly the source code of AI is which is making Entity predict the future, and the entity had very clearly predicted that where Tom Cruise would be, what he would think, and how he would do. So similarly, Tom Cruise had another movie where they could predict murders before they were happening. So if you use AI, you can actually predict a woman who can develop a PCOS, a woman who would probably have gestational diabetes, a woman who would probably have complications and poor prenatal and postnatal conditions during delivery. So a lot of these applications are now coming in, and it is not a matter of science fiction. It is something which is happening in real life. So, some things like midlife crisis, personalized medicine. Personalized medicine is the matta today. So, today we are not going to write a prescription and ask the patient to suit the prescription. Today we are going to write a prescription which suits the patient. So, all PCOSs cannot be just given metformin blindly. All gestational diabetes cannot be given only insulin blindly. So, depending upon the condition of the patient, whether we need to give metformin or insulin or what, it has to be dependent upon the genetic, the socioeconomic, the behavioral characteristic of the patient, and these kind of figures cannot be determined by a clinician unless you use AI. So these treatment gaps of personalized care cannot be given without the AI. And imagine if you can manage 5 patients in your OPD currently, and instead if you can manage 50 patients in your OPD because of your AI technology. Not only can you do justice to more population, you can charge less because you're doing teleconsultation, which may not be as expensive for a patient because a patient has to come physically to your OPD, wait outside, spend precious time, take your appointment because you're a big shot, a big doctor, a busy name, and then you go back to your own home and travel all the way, spend on transport. All that can be bypassed when you're doing a teleconsultation. So lots of cost of dollars and money, rupees can be saved. The work protocol of the patient is not affected, so she doesn't have to take a leave. Many times, my patients have to take a leave for a day if they're coming from far away. So there is a lot of revenue lost, and the number of admissions can get cut down. So a lot of GDR can be saved and money can be saved. If you go further, you realize there are diagnoses which are missed. So imagine a lady who has probably got placenta previa and she dies because it was not picked up on sonography. Imagine a conventional sonography not picking up fetal malformation, which AI can give you a better coverage. Imagine the kind of now Dr. Bharat has developed this wonderful app called Mitra. He's already received the prize. He's already received the prize from ADA, and I would like to congratulate you on a public platform, Bharat Bhai, for doing a wonderful work and establishing the role of AI. And coming from Indore and coming from India, this is a landmark achievement which should inspire all of us to shake hands with AI and learn from this gentleman how he's changing the lives of people for tomorrow. So this is an approved application which acts like the name suggests, Mitra, like a friend to women, to men, to everybody. And it is like a 24 by 7 doctor in your box, in your inbox, in your pocket, which can guide you, give you a responsible behavior, caregiving behavior, can cover your problems very nicely, and does not treat you because that is the domain of a doctor, but can guide you at the right moment before complications develop, that you can meet your healthcare provider and take your treatment further. So all those issues and all those parameters can be taken care of when you put AI. So if you look at the four verticals which are important, the opportunity area, the research can be boosted, the diagnostic capabilities can be increased, treatment quality can be enhanced, and the reach and access can cross national and international boundaries and reach a patient wherever you are. I'll go a little further than this. I'll give you some little facts and figures as a summary figure. So there is sort of in mammography, the improvement has increased by 25%. In unnecessary procedures like doing a biopsy on the breast and doing unnecessary laparoscopic or robotic surgeries can be reduced by 40%. Imagine picking up cancers 15% earlier than in the past by standard rate. And imagine that you're increasing the survival of a cancer patient by 92%. So these are not figures that I've generated for the PowerPoint. These are actual facts and figures which have got references in medical literature where AI plays a very important role. So the kind of risk assessment you have, the kind of variable. Now, this variable analysis is something I will just talk about in 10 seconds. This is called cluster analysis. So I give a very classic example when I give my talks, So right now in Mumbai, we are having monsoons. And the Indian Meteorological Department always predicts, that after 3 days there will be heavy thunderstorm and showers. And you know that that day actually there is no thunderstorm, it is very hot. And then they say that after 3 days, there will be a dry spell, and suddenly there are a lot of thunder showers and lightning. So, why does that happen? It is not that IMD is not performing well, but there are so many variables which a classic binary system of a computer, which deals with 0 and 1, cannot take care of. So, when you're treating a patient and you want to know whether this lady will develop gestational diabetes and whether she will have a preterm abortion or whether the fetus would be deformed or not, these are some kind of analysis that you can't do by classic methods because they take care of your diet, they take care of your lifestyle, they look into your epigenetics. All those things cannot be decided by a clinician. So these are variables, you cannot correlate. You can correlate a blood pressure and development of stroke. You can correlate pulse rate or tachycardia and development of arrhythmias, right? But then you cannot correlate the lifestyle of a patient and give accurate markers whether this lady would develop gestational diabetes 2 years after marriage or not. So this kind of variable analysis, which is called as a cluster analysis, because you're grouping it into clusters, is possible with AI. So that kind of a situation is picking up because of application of AI in women, and this is helping the clinician give you a much better approach to treatment. So the last part I would like to talk about, I've covered the first three topics, verticals already. The last is mental health. How to take care of a woman who's physically sick, who has lost her baby, and who has realized that her infertility remains to be infertile. She has gestational, she's got a G3 para zero and abortion three. So she has conceived 3 times. She has had 3 abortions, but she has not delivered even once. So she's G3, P0, A3. What kind of a mental health that lady would have? And they cannot keep coming at your door every second day for consultations or go to a psychiatrist or a counselor. So this is where a chatbot helps. A chatbot can actually give a lot of comfort and sort of an equitable guidance and a sort of a technically sound and a medically sound guidance to tell them what are the problems and how do you cope up with these mental issues. And if Bharat Bhai were to share the Mitra app with you, you'll realize Mitra does a lot of such kind of work when you're dealing with diabetes and you're dealing with mental problems because of diabetes. Personalized medicine is very simple. New molecules are coming in, new kind of approaches are coming in. Even if you use Chat GPT on your own, you will realize that you will be able to pick up a lot of data and management, which will be very unique to that patient, which is not sort of something you can pick up from a textbook of gynecology and obstetrics and copy paste on your prescription. So I'll move ahead here and I'll I'll show you some of the real life data in India and abroad to support what I'm saying here. Something which I wanted to show on this slide, which is very important. Suppose you were to put AI in the employee wellness situation in a workplace, it plays a huge amount of difference. So when there is an interpersonal relationship or a client service provider relationship or a boss and an employee relationship, and there are physical and mental problems at stake, when there are sexual issues at stake and the HR needs to get involved, that is your standard atmosphere prevailing today. And if you can put an AI chatbots in place in multiple levels of grading in your workplace, and if AI were to act as an interface between these different relationships that I've spoken about, the boss and the employee, the client and the service provider, the two friends who are working as co-workers, and AI can actually steam up a lot of things, get a lot of cohesive moving, can show a lot of data, live data, results generation in workplace, and can create a lot of source of inspiration. And am I talking to my hat? As you can see the graph below, you can see that a lot of data, employee satisfaction, client satisfaction, and productivity has gone up drastically with AI put in place in multiple workplaces. So this enhances the output of a company and the revenue of the company gets better generated. So this also is an example to tell you that because of AI, jobs will not be slashed, but people who are not trained in AI will get slashed by people who are trained in AI because an AI workforce can perform and deliver at a faster time at a better output. I'll give you one simple example. So we at Doc Yantra and Shipken have been conducting a lot of programs on how to create PowerPoints through AI. So this PowerPoint is an example that I've created through AI. So suppose your boss tells you that I need to have three presentations tomorrow for the client who's coming from overseas. So Mr. Binau, you need to have three presentations ready. Otherwise, I will not give you your increment. And that poor guy goes home at 9 p.m. and starts creating those PowerPoints manually. He spends his entire life, destroys his family life, is not able to give time to his wife and his children. And imagine if those three PowerPoints are created through AI, those three PowerPoints are ready in a fantastic manner in less than 3 hours. And he can enjoy his family life. So that's an example of how an AI can turn your workplace into a better output workplace. And especially if it is a woman, because she has to take care of her children and her husband and her kitchen when she goes back home. Can you imagine the kind of workload it snatches from her head? So the kind of reports you have to create, the kind of statistical analysis you have to do for your sales pitch and your sales figure, all that can be taken care of by AI, and that makes it very unique. And that's a general example, but it applies also to women in workplace. So for menses, menopause management, endometriosis care, fertility optimization by infertility dealing healthcare providers, and hormonal cycle tracking. These are real life apps which are available today, which are generated through AI, and you're doing a fantastic job. And the kind of improvement you're getting in real life is like 40% improvement in diagnosis, 30% reduction in procedures, 65% more satisfied patient, and overall cost getting reduced by 25%. Now let's come to some specific examples. In the UK US data where the model has been trained in the Google's health algorithm, which is existing, the model training in the kind of patients that they used in deep learning for mammograms versus conventional mammograms, they could find that the false negatives were reduced by 9.4% and the false positives were reduced by more than 5% in their own clinical trials. And they showed that the area under the curve was higher by 11.5%. So can you imagine that the area under the curve boosting by 11% is not a joke? It is a huge thing. Bumping up an AUC by 11% is significant statistically, and the triaging that it does is reduced by 88%. So I'll give you another example. So suppose you're a radiologist and you've been given some 500 mammograms to review and report. So what happens is out of those 100, if 80 of them are normal, you will spend around 10 minutes per mammogram, right, to report them. Your entire day would go in spending it. You'll get burnt out and tired after you've scanned 100 mammograms. But now suppose you're doing a global screening, you're doing a full Mumbai city or a Calcutta city or a Madras city screening, and you've got some 1,000 mammograms. You will either have to appoint 4 or 5 uh, doctors who are specialized in reading mammograms, or you can put it under the AI tool and it will say that out of these 500 mammograms, 450 are normal. You don't have to waste your time. Just sit down with these 50 mammograms, which AI says I have labeled as abnormal. I have given you the diagnosis. Just go through them, finalize them, put your signature and send it across. So you're getting paid for 500 mammograms, but you're actually reporting only 50 mammograms, and your entire things are ready. Your reports are pre-printed, your signatures are in place, your mailings are in place, everything is taken care of. But does it come at the cost of accuracy? No. On the contrary, the cost is higher than what you would do. And is it replacing a doctor? No. The doctor has to finalize the final report. It is only aiding the doctor. Am I talking out of my hat, out of India? I'm talking in India now. This is Niramai's thermalytics platform, and the lady who's doing it had actually presented this in one of her meetings in the journal club, and she showed very clearly that infrared thermography. So this is better than mammography because there is no radiation, and they have used this in a Punjab program on 15,000 patients, and it categorized breast thermograms into 5 risk levels, and the outcomes was 0.18% cancer detection fees, which is around 820. Nimish, I'm giving a talk online. Please pause me later. Uh, Clinical Trials India reported 91% sensitivity and 82% specificity for thermalytics. The accessibility impact was huge. The portability and non-invasiveness gives it a promise for mass screening in India, which is a low resource setting. What about colposcopy? In women, colposcopy plays a very major role. Picking up cervical cancer, and cervical cancer in situ is a big thing. And any gynecologist will tell you the colposcopy is one of the mainstays of therapy, and there are gynecologists who specialize in colposcopy. And Dr. Priya, who's a colleague of mine who stays in Thane, has done tons and tons of colposcopy. She's now a national figure in implementing colposcopy in multiple rural and urban settings. Now, you add to that the EVA system of mobile ODT, and this kind of gives you a mobile augmented colposcope. So this is something that you can use right from your own mobile phone. As you can see the image on the right, it is not something that you're buying a very hi-fi instrument. And this has been a large pilot study in Apollo hospitals in India. And they're using smartphone-based EVA system in real time. It gives you 3 times better pickup than a conventional pap smear. The augmented intelligence enables these workers who are not doctors to go ahead and do the evaluation of cervical lesion in real life. And now it has moved into 29 countries with biopsy and cytology results, and they have picked up accuracy and fall true positives to be in a much superior manner than the conventional colposcopy setting. Let's come to another very important area of gestational part, or something which is very important in a woman's life, that is pregnancy. Now, fetal ultrasound is very important. You must be reading the papers. There are so many court cases going on where the fetal malformations are missed in conventional radiography or sonography. And there are some very bad stories coming out in the media where the radiologists and the gynecologists have undergone penalty by the National Consumer Forum by Delhi. Because it's not that they do it purposely, but a deformed limb or an absent limb or a placenta previa or an abnormally breech presentation is all missed in the early stages of sonography, and the price is paid by the parents who don't like it. So deep learning implementation on the second and third trimester of fetal ultrasound could predict many things, and they could find it to be 44% more accurate than the standard headlock formula that they use today in sonography. And they could not only do that, they could do enhanced sort of a scanning which was done through your smartphone, which they call as the blind sweep ultrasound AI, which has also enabled doctors, I mean, which has also enabled people who are not doctors to sort of estimate fetal age and can pick up damages to the fetus, which is the kind of reporting you get is as good as a radiologist seeing it. So that is a kind of a AI suite that they have developed, which is workable on a standard smartphone. What about the newborn which has already taken birth? Does an AI role play a role over there? So AI-enabled smartphone tools like the BillyCam, which is used by University of Washington, is using a simple smartphone camera and a color calibration AI algorithm to pick up neonatal jaundice much earlier than a clinician can pick up. And again, is this something like a wow or is it like a how? So if you look at the how, in 100 infants, the study was done, it achieved a 0.85 order correlation with laboratory bilirubin values. And these kind of image processing apps can actually tell the parent who have taken a discharge and go home can pick up neonatal jaundice much early with more accuracy. And it is very simple because this can be worked up on your own smartphone. So such kind of tools are being developed for newborn hearing, for newborn arrhythmias and congenital heart diseases and other kind of screenings like deep mind mammographies, Punjab Thermalytics Program, Apollo's mobile dot, which I've already covered, and they all have shown very high accuracy rates in their own data sets that they have analyzed. Now, the mother can also use certain sensors which she can wear and go. So, like there is a startup like Save Mom platform, then there is a cloud analytics. So you don't have to worry about the security because a lot of this runs on AWS, which is our Amazon data cloud, right? Which is one of the topmost data clouds in the planet today. So they're running on these kind of cloud analytics. So you don't have to bother about blockchain technology or data leakage or data privacy and all because Amazon and Microsoft clouds are responsible clouds and they take care of it. You can link this cloud to a rural-based program which does not have any kind of infrastructure, which are running on ASHA workers, and that entire analytics can be done on the cloud, and the results can be delivered to you sitting in Indore, Mumbai, and Calcutta, and you can take it from there. So this has been recognized by leading companies like Samsung, GE Healthcare, and other companies, and they're actually using it in healthcare intervention, and they're giving a much better kind of a thing. What about government of India? Are we talking through our hat, or is it got some nod from the government of India? So the Andhra Pradesh government has accepted this program called Janani Mitra app. So this Janani Mitra, Janani stands for mother, Mitra means friend. So this Janani Mitra app, which is using an AAIM consortium, is using this tool to pick up maternal nutrition and maternal diagnostics. So a woman who's pregnant can just scan her eyes, her tongue, and her nails, and then it can pick up anemia. And this can be directed automatically to an ANM nurse or to an ASHA worker, and anemia can be treated within the seventh month or probably the fifth month of pregnancy, and the woman can be given a better care rather than wait for a doctor to go and see. And I think this is very applicable because, see, today many doctors are being forced by the government not to do their post graduation but to undergo this bond. They sign the bond and they're pushed into rural area to serve the rural area for 2 to 3 years with very poor facilities. And friends have told me that they have no way to do laboratory checkups, they have no way to treat anemia, they have no way to control and pick up anemia because the infrastructure is not there by the government. So imagine if the doctors are not pushed because of their bond, and this is handled directly by the ASHA worker in her or her own mobile, it can make a jot of a difference. There are SOS alerts. There is a barcode food calorie scanner, and it can tell a pregnant woman in a rural area which kind of food is better for the baby and which kind of food is not better. So all this is controlled by the AI and gives you a very good kind of a output. So just as I spoke about Mitra, you have chatbots and reproductive health. So Maina Bolo is another chatbot which is created by a ChatGPT model. And it answers a lot of questions to a woman about her sexual and reproductive health. In Mumbai itself, 80 users were tested about contraceptions and sexually transmitted illnesses, and they got sort of a very good answers, and they give non-judgmental answers. So they were not acting like a moral police, but they were sort of guiding the person to have safe sex and how to use contraception and safe sex. So this NLP solution is something which is very important that all of you should know because most of us are researchers here, and natural language processing on NLP can scan your own records. So let's say Dr. Bharat has got 5,000 patients database. I'm sure he has more. I've just used the figure of 5,000. Dr. Dhar maybe has a record of probably 20,000 patient database. Dr. Shambhu has got a record of probably 10,000 patient database. You just put NLP there. You can do all the analytics of your own data which you're having for the last 20 years, and you can get very sound answers, and you can take it forward from there. You can do your own business analytics in your own clinic. You can do your own patient guidance analytics. You can develop your own kind of a chatbot where you can develop this analytics to talk to your patient and guide them further. So, to summarize, even in mental health and behavioral support, there are chatbots, there are virtual supports for 24 by 7, there is a risk identifier, AI tools which are available, and all these tools work in synergy to get your pregnant woman and a child to move further. Now, remember one thing, you can marry a Hollywood or a Bollywood personality and you can feel very good that you're the most lucky husband in the world. But naturally, there's a price to pay with that, right? So, similarly, when you're using a glamorous tool like AI, which is doing all the work for you, and it is doing a fantastic work, and it is looking like a Hollywood personality in your pocket, there is always a caveat, jo bolte hai na, there's nothing like free lunch. So, some concerns are going to be raised when you're using AI, and if you don't use it well, you could end up having a lot of problems. So there's something called as data privacy. Of course, I told you just now that if you're using clouds like Amazon and Google and Microsoft, this data privacy is not so much of a concern, but the interface where you're doing it in your own clinic could have data leakages. So that is something because you cannot compromise on patient confidentiality. The algorithm that you have developed, there are a lot of examples where the algorithms have been developed in the Western world, but they're not transferable to the population in India. It doesn't work that way. So we need to know that our own algorithms are done and trained in Indian population and they work in Indian population. So that algorithm bias should not be there. And we have a lot of EHSs running, you're running one kind of a EHS, I'm running another kind of an EHS, the other clinic will be running another kind of an EHS, and they need to talk to each other for the AI to work well. So the system integration with different kind of healthcare infrastructures from a corporate hospital to a nursing home, all of that needs to be there. And you as a provider, me as a provider, and another 10 people as a provider need to know how to use this AI tool in a proper manner. So they need to be trained. And that training has to have a approval from a regulatory body that you have been well trained and you would not misuse it. Something very important that we forget when we're doing glamorous work, do we ask our patient, I'm using an AI tool, do I have your consent? Can I use an AI tool? We never ask that. You should be aware of that we cannot use AI on a patient without the patient understanding that an AI is being used. And let me take this further. I discussed this in another meeting, and this was a very important part of the meeting. That 10 years from now, if you feel some doctors had raised this question, why should I use AI? It is loaded with complications and I don't understand because they are scared of AI. And then if you do not use AI and your productivity has gone down and your patient takes you to court and tells you that because you didn't use AI, I have developed a malformed child. My pregnancy ended up in abortion, whereas my colleagues, my friends who are using AI are having a much better rate and a very low failure rate. So, do you take consent from the patient when you do not use AI? The other side of the story. So, that is also important that you should know. So, you should have an equitable access to solution. You should have protocols with assured quality and your own AI tools, just as your drugs undergo trials regularly, your own medical knowledge undergoes CMEs regularly. You need to upgrade your medical knowledge by attending such wonderful conferences that we're doing right now. And I'm learning so much since morning, and I would be learning in the next 2 days from all of you. Thanks to the organizers for creating such a wonderful platform where we are getting enriched in women's health in multiple parameters and multiple combinations and permutations that we have not learned 10 years back or 5 years back when we did our post graduation and undergraduation. So that kind of assessment should be there. The kind of assessment that you have should have a metric for tracking it and should be evaluated without a bias. So I'm coming to the end of my talk. Moving further, we should know that innovation is there, collaboration is there, and metrics are there. These are the three pillars on which AI runs. You need to have different innovative ideas. You need to develop more and more AI tools and solutions which fit with the current problems with healthcare and can help them. And these AI tools have to be evaluated, have to be justified, just as we have justification, statistical justification for our drug trials. And they have to be calibrated and justified, and metrics have to be laid down that these parameters are AI tools are actually working. And they need to work not only technology, medicine experts like you and me, technology experts like engineers, and policy framers like the government have to work hand in hand in synergy so that the center of the ecosystem, the patient, actually gets the real benefit, and we give a better care in 2026 than 2025, better care in 2027 than in 2026 and 2025. So the healthcare providers, the researchers, the policymakers, and the patients, these are stakeholders. They need to shake hands and they need to get this moving to understand that the woman is a very prime person in your life, my life, and everybody's life. And let us develop solutions which are specific to the fairer sex, the better sex of humanity, and they should be designed in such a way that her life, her premarital, marital, and postmarital, her work life, and her home life, her reproductive life undergoes a transformation for better than it was so far through AI, so that we can deliver healthcare equality, data driven solutions, human AI partnership, and we can innovate our solutions on a regular basis. The mantra before I conclude is very important. Tomorrow, we are not going to practice evidence based medicine, we are going to practice data based medicine. So far, we are practicing evidence based medicine. Tomorrow, you generate data, you can generate your own AI solution, you can implement it live, and that is where things move forward, and you can do justice to your entire population and women, the fairer sex of the population. So I'll stop over here with one simple thing. Thank you to the organizers, all of them, for this wonderful opportunity and this method by which we can reach out to the fairer sex. And before we conclude, we would like to say thanks to our mothers and our sisters and our daughters that we care for you and we would love to continue caring for you. Thank you very much once again.